Welcome back to Bloom. Coronavirus is a concern to heart health. Joining us to discuss is Dr. Stephen Sinatra, a cardiologist with Healthy Directions. Welcome, Dr. Sinatra.
Oh, it's great to be here.
I'm so glad you're here. We love that we have so many experts to come on Bloom and give us the information that maybe we're Googling or we're seeing on the news. So I want to know, in your opinion as a cardiologist, have you ever seen a more threatening public health crisis than COVID-19 and what we're dealing with right now?
You know, I've been exposed to a lot of influenzas over my career, and I've seen a lot of cardiac complications, but nothing of this magnitude. This is the worst that I've seen. And I've spoken to my colleagues about this who are on the front lines, and they all agree that this is very unusual and unfortunately very tragic.
So why, in your sort of expertise with COVID-19 in the heart, what's so scary and how is it affecting the heart?
Well, here's the problem. Once you get the influenza virus into the lung, what happens is that the heart and the lung have a similar circulation. And basically, what can happen is even when people recover from the influenza with the lung situation, a few weeks later, maybe a couple of months later, they can develop myocardial involvement. We call it myocarditis, where now it's inflammation of the muscular tissue of the heart. The good news is lots of times these situations clear up on their own. However, occasionally I've seen patients develop heart failure and cardiac arrhythmias where they needed expert cardiovascular intervention. So we pray and hope that we don't get, cardiac comorbidities. But there was a study in China that came out. It was about 419 people, and about 19% of these, almost like 1 in 5, developed cardiac situations, despite the fact that they had normal hearts to begin with. So the virus can be, invasive to myocardial tissue.
So that's a little bit scary. So someone could have it, almost recovery, but then still needs to be concerned with anything related to their heart?
Great. I'm glad you raised that again, because the takeaway is this. If you develop COVID-19 and you get through it, and most people get through it in a breeze, let's face it, it's the older age group that really has the problem. So if it's a breeze and everything's fine, and all of a sudden a few weeks later you get a little swelling of the ankles, you get a little shortness of breath, you have a little bit difficulty breathing, you're laying down at night and you're breathing heavier, that can strongly suggest cardiac involvement. And that's when you need to call your doctor and say, I had this virus, I felt good with it, but now I'm not feeling so good. So that could be cardiac involvement. That can be a few weeks to maybe a couple of months later. And it's important to notify your doctor. And again, the good news, lots of it clears up on its own, but some people need intervention or pharmaceutical support,
The awareness is also good to sort of have that connection. Another condition, high cholesterol, how can that impact and complicate COVID-19?
That's another great question. I have a feeling that high cholesterol may protect you, believe it or not. Oh, yeah. There's an entity in children, they call it MRSA staph. And, I wrote the book, The Great Cholesterol Myth, years ago, and it's being revitalized now. But I have to tell you, high cholesterol protects people from gastrointestinal infections, and it can protect people, or especially young children, from MRSA, which can be deadly. So the higher your cholesterol, it's kind of interesting, the more protection these children had from staph. And we've seen more protection in the GI tract. And remember, a virus can attack the GI tract as well as the brain. So could high cholesterol be a protective factor? Retrospectively, I think the researchers are going to sort this out over the next few months. It'll be really interesting.
Wow, that is interesting. I should tell my husband with high cholesterol that he's doing okay.
Well, put it this way, there's all sorts of things, like blood type O may be protective. I'm sure you've heard about that. And yet high cholesterol may be protective. I mean, again, I think the great cholesterol myth is overplayed. I mean, cholesterol is so important for the body. Let's face it, when the sunlight hits your skin, you make vitamin D from the combination of cholesterol and sunlight. Cholesterol is good for your sex hormones and other hormones in the body. I mean, it forms bile salts in the GI tract. Cholesterol does a lot of good things for the body, and it may protect you from this virus, but that's my possible hypothesis.
Okay, well, I like that hypothesis. One more question, semi-related to heart health. I know people out there have been talking about anti-malaria medication for COVID-19, but that can have heart complications. So what would you say about that?
Well, let me answer it this way. If I had COVID-19 and I was offered hydroxychloroquine, I wouldn't bat an eye as a heart specialist. Yes, hydroxychloroquine can prolong the QT interval, and which means that you can get some malignant arrhythmias. I get that. But you know something? 19,000 people a year die from aspirin, from GI bleeding. So as a heart specialist who knows about the QT interval, who's dealt with these torsade the point arrhythmias, during my entire lifetime, I think that if I had the virus as a heart specialist, I would go for the hydroxychloroquine. And they can always measure the QT interval. It's so simple. And you're only taking it for a limited amount of time. But remember, when it comes to hydroxychloroquine, I think the data is out. It's coming in daily. But I think the earlier the intervention, the better.
Okay, well, I appreciate that answer. We love how we can get the information from the experts, and we really are so glad you joined us today. Want to let everybody know for more information, they can visit drsinatra.com or follow him on social media at SinatraMD. Thank you so much for joining us.
Thank you. Thanks so much.
All right, guys, we'll be right back with more Bloom.